Hi everyone, I'm just going to give another couple of minutes just to get everybody in and then we will make a start. So thank you for bearing with. Okay, so yeah, I think I'm just going to make a start because yeah, we've got quite a tightly packed schedule. We want to make sure that we get everyone in. So can someone just give me a thumbs up, make sure that I'm being heard okay? Yeah, brilliant, great, thank you. So good evening, everyone, and thank you for joining us tonight. So just to let you know that this webinar is being recorded, first of all. My name is Becky, and I'm a careers advisor and the group careers coordinator here at Eastern Education Group. So it's great to see so many of you interested in learning more about careers in the health and social care sector and how to get into them. So tonight's session is really about helping you understand what opportunities exist in the sector. We have some real experiences from apprentices, which is great just to find out how these opportunities, how you get into these opportunities, how they go, and hopefully give you some ideas about what or how this pathway might suit you in the future. So health and social care is an incredibly important sector. And I think this will be echoed by all our speakers tonight. So both on a national level and a local level, our area across Suffolk and the wider region, there's this huge demand for skilled people to work in these roles that support health, well-being, and just that whole general care of others. And it can include working in lots of different settings like GP surgeries, community services, and other environments. One of the things that we talk a lot about in careers is labour market information. So this is basically looking at what jobs are available, where the opportunities are, which sectors are growing. And health and social care is consistently one of the largest and fastest growing in the UK. So there's loads of opportunities for progression, training, and long-term careers. And there's lots of opportunities available, and it's a really varied sector. So you can start as a care assistant or support worker through an apprenticeship, for example, and then progress into more specialised roles, such as nursing, for example, healthcare science, but social work as well. So apprenticeships can be a really great way to do this. Of course, it's not all about qualifications. There's also some really important personal skills that employers look for. So things like communication, being able to listen to people, show empathy, it's really important. So those are the kinds of skills that help you support people who may need that care, guidance, or reassurance within healthcare. So tonight you're going to hear from apprentices, from people within the sector about how to kind of get into those experience and find out more about that the wide variety of roles. So it's a really good opportunity to hear the kind of roles that you can do, how you get there, and that kind of day to day. So please do ask questions. You can use the Q&A chat, which is enabled for this webinar. No silly questions. That's what it's all about, and we'll do our best to answer them. So first of all, I'm going to hand over to Ruby, who is our Business Development Executive for Health and Social Care, to start us off. Thanks, Ruby.
Oh, I know you said good morning. It's definitely not the morning. It's the evening. But good evening, everyone. I'm just going to share my screen, hopefully, if it will let me. I've just got a couple of slides to go through. Yeah, as Becky rightly said, I basically look after the enrolments for all the apprentices currently within health and social care. So my role is to speak with employers, try and find the vacancies and get that first bit started, and then once I've enrolled you, you'll then be passed over to the delivery team, who then deliver essentially the content. I don't teach, luckily for you, but so just to get started, I thought I'd just mention quickly about what apprenticeships actually are. Can you see my screen? Sorry, I forgot to ask. Yeah, great. Okay. So essentially, if you are not aware, apprenticeship is a job with formal training. So it's earn whilst you learn is the title for it essentially. But it's available for anybody over the age of 16. There's no upper age limit. So even if you're looking for a career change and you haven't got any qualifications, you can get into the job before actually doing any studying beforehand. It just depends on what level you want to start at. It's a recognised qualification. The apprentices don't pay for the qualification themselves. It's either government funded or funded partly by the employer. It's a way to actually get into the sector, especially sector like health and social care, without having the experience. A lot of jobs that we're finding are listing, 5 years experience or have done this before or whatever. And an apprenticeship is completely opposite, essentially. You go in and you start your job and your training at the same time. So there's no need for experience beforehand, which is why it's so great, people maybe leaving college that have done a little bit of knowledge about health social care, or someone looking completely change their career path in general. Currently at the college, these are the courses that you can study with us as an education provider. With an apprenticeship, you obviously need an employer. So what would happen is, part of my job, I would either work with you to find somebody, or potentially, if you're already working within the sector, go to you with your manager and we discuss what level will be best suited for you, how long the courses are, and how the apprenticeship works around that. There is no pay cut. You get paid for the work that you do, essentially. So you will have a day here or there to do college work as part of your off-the-job hours, but you get paid for that time. And the employer has to pay you that as part of the apprenticeship wage. But yeah, so level 2 is the baseline level. So if you haven't had any experience in the sector at all, and you're looking to, potentially develop skills that may not be there currently, the adult care worker level 2 and the healthcare support worker is where you'd start. If you have had a bit of previous experience, we would then put you on the level 3 and work your way up from there. Level 4 and 5 obviously go up to HS and degree level, which is often linked to managing and the managerial status level. So if you do your level 3 and you get a couple of years experience and your job then progresses you into somewhere that is management material, you would then go on to the level 4 and 5 and get a qualification in leading and managing, but specifically in adult care. So it's a bit more specific than your general team leading or your leadership and management qualifications. So in health specifically, depending on what pathway you want to go down, we have the level 2 healthcare support worker, which is your entry level qualification. That's 18 months for the entire program. And then you would move on, or you would potentially start at the level 3 senior healthcare support worker, which is 24 months. Now, the list underneath is the specific pathways that you do alongside the course. So you would do the bulk of it as general healthcare support worker, and then you would have optional units, different units that you would then pick for your adult nursing, allied health professionals, children, young people, maternity, mental health therapy, and diagnostic imaging. This will really depend on your job role and what works for you, to link it more designed around what you're currently doing or what role you'd be going into. And then level 3, which actually we have released today, so brand new standard, is community health and wellbeing worker, which is 15 months. Now this is linked more to GP surgeries or people working in public health. It's a little twist and spin on something that we don't currently cover, so hopefully this will get us a wider range of roles within this sector. Now, social care is kind of where you can start at the beginning and work your way all the way up through an apprenticeship. So we do have the foundation level 2 adult care worker apprenticeship for those that are 16 to 19, and it's an 8-month kind of round trip quick apprenticeship that gets you a recognised qualified level 2 qualification. If you are above 19, then we would put you on the level 2 adult care worker, which is a 12 to 15 month programme. Level 3, again, it depends how much you want to learn and develop, whether you start on level 2 or level 3. And then level 4 and level 5, like I said before, is the managerial levels, and those are 2 years, 18 months to 2 years. That was a quick round trip of apprenticeships in general, and how they work and what standards we study at the college. And it's a really, really good opportunity for somebody that is looking to go into the sector or looking to upskill going forward. First you need to do is find an employer. If you're already employed in a healthcare or social care setting, that's great. We can then speak with the manager and hopefully get you your apprenticeship. If not, my job is to help you find somewhere. So I'm always contactable through the college, through careers, anywhere like that. Just pop me a message on Teams or an email and I'll give you a call. We'll figure out, whereabouts you are, where you can travel to, who's currently looking, what vacancies are currently available. Once you do find that place and you secure yourself a job role, we then you get in contact with us if you haven't done so already, and we start your enrolment process, which is what I do, where we send out all the forms and we go through the boring admin side of it, essentially, where we have to sign you up government wise so we can all get the funding, and then you'll have your initial induction, which is where I pass you over to the delivery team, and then at the end of your apprenticeship you'll have something called an endpoint assessment, which is your final round task for your apprenticeship before you are then qualified. I didn't add it on here, but what I would also say is we currently do have vacancies live on our website in social care. So Leading Lives have 3 vacancies. They are an adult care provision, a daycare centre essentially for those adults that have learned difficulties. They've got one in Stowmarket, one in Ipswich, and one in Lowestoft. So please have a look on there. We also have a vacancy available for Larch, which is a care provider in Ipswich. It's a lived-in basis, so you'll live in the care home with food provided for you for the 18 months that you're on the programme for. Essentially, it's just one big family, really. So do have a look if you are interested. They're coming up all the time, so please keep an eye out. And that's on the West Suffolk College website. But yeah, if you have any questions, pop it in the chat. But that's all from me. Thank you very much.
Thank you, Ruby. Really timely for that new one that's just been delivered today. So that's great to hear about. Thank you. And sometimes I think finding because there is such a huge variety of roles, finding out more about them can be quite difficult. So having that exposure to those environments where you can go and find out a little bit more is really great. So we've got Rachel Grimwood from West Suffolk Hospital here, who's going to talk about a little bit about how to do that with the health academies and the volunteer service at West Suffolk Hospital.
Lovely. Thank you, Becky. I'll share my screen. Hopefully we'll be able to see. Can everybody see that okay?
Yes.
Yeah, lovely. You're always nervous, aren't you? Okay, so thank you for inviting me along. As Becky said, my name is Rachel Grimwood and I'm the Volunteer and Academies Coordinator at West Suffolk Hospital. I work in volunteer services. So essentially what we do is help support the hospital with volunteers, but also help students come into healthcare, have a little bit of an experience so that they can sort of show future employees what how they've got into healthcare and how they've had some experience. So there's a few things that we do. The first one is the Health Academy. So we hold this twice a year, and it's aimed at 15 to 18-year-olds who know that they want to go into healthcare, but maybe they might not have an idea of exactly what they want to do. So what we do is it's held on a Saturday morning in our education centre, and you come along for the 4 weeks, and what we do is we try and make it interactive. We give you some hands-on experience, and we try and invite as many people in as possible so you can have a talk to. When we ask you to apply, we ask what profession you really want to see. We can't get all of them in because obviously there are a lot of roles out there, but we try and get the sort of most general ones, medicine, nursing, any allied health professionals, those types of things. But if we can't do that in the session, then what we try and do is set up a call with somebody after the academy so you can speak a bit further. On the slide, it just gives you a bit of an idea of what the sessions are like. We try and change it every time round so that we can update all the time. So we'll talk a bit about professionalism and the role of nursing in week 1. We do interactive sessions in the clinical skills lab. So if anybody's been up the hospital, we have proper skills labs where we've got dummies that interact. You've probably got a similar thing at the college. So you can imitate sort of heart disease or heart problems and that type of thing, and we do have a day coming up soon where we're going to have some medical students do some scenarios, which is quite exciting. Week 3, we have a marketplace where we have a range of departments. We've got that coming up in the next couple of weeks where we've got about 15 departments showcasing their departments and talking to students about how they got into their roles, what challenges there are, which I think is important, as well as the good points. And then week 4, we talk about your personal statements, completing applications, developing interview skills, and then we will do some mock interview sessions as well. So that's a really exciting opportunity. We hold it twice a year, and we have around about 40-45 students on each time. So you get to meet people that are in, the similar minds to you, and be able to talk to each other about, coming into healthcare. Leading on from that, what we do is clinical shadowing. So this is more for people that know what they want to do. So you may have come along to the academy and you think, actually, I think physiotherapy is something I'd like to do. So what we ask you to do is write a personal statement on why you think you'd be suitable for clinical shadowing, send a CV, and then we approach the departments. And then they can generally with physio, especially, they can give a 2-day experience. So you'll go around the different departments. You might go into respiratory, you might go into stroke units, all of the areas that our physio team go into. Other types of clinical shadowing we do is nursing. They are set days once a month. We have lots of other different roles. Cardiology is a good one. Currently our medicine one is on hold, but I hope that will come back soon. And we can't go into places like psychology or children's areas because it's a bit sort of a difficult area, especially if you're from around the area. We don't want you interacting with people that you might have gone to school with or something like that. So yeah, clinical shadowing is really popular. I was doing some stats today actually, and we've had since Christmas we've had 56 people in, so it's been really good. So it's really sort of a great thing to do, so then you can put it on your personal statement. The next thing we do is student volunteering. So again, this gives you a good experience on what it's like in a hospital. A hospital can be quite scary if you've never been in one before. So it's a really good idea to come in and sort of find out a bit more what it's like on a ward. I mean, if you've never been on a ward before, sometimes you can walk into a ward, it's noisy, it can be quite smelly, it can, there's lots of bustle going on, but I think it's just as important to know whether that experience is the right thing for you, as well as knowing it's a good experience and what you want to do. So we do spend a bit of time with you going through our handbooks and that type of thing, making sure we put you in the right place. We have a discussion with you and we make sure that the ward you're going to go on hopefully will be the one you want to go on. It's all centred around meal times, so it's a good way for the student to get involved on the ward. So you're handing out meal trays, you're tidying up their table areas, and sort of just so experiencing what's going on in the hospital. So you might see other professions in there, especially the allied health professions, so like your OTs, your physios, all of those type of people that are in the ward, and the doctors' rounds as well. You must be 16 to apply, and we do need agreement from your parent and guardian on your application form. There is a real high demand, so we do have a selection process. So we ask you to do again a personal statement to say why you should be selected, but it's very rare we turn people away, but it might just be we might have to get you to wait a little bit of time. You have to commit to 50 hours. So we think that's a good sort of round time for you to get that experience. We haven't got it on here, but we do a reflective diary of aims and objectives, and it's lovely to see a student comes in that's really shy and nervous, and then they get their experience, and by the time they leave, the confidence in them is lovely. It's so nice to see that. The shifts are between 2 and 5 hours a week. 5 hours is the maximum we can do because you're studying. So generally it's breakfast, lunch or tea, or at the weekend you could perhaps do a breakfast and lunch together and spend a good 5 hours in the department. So they're the sort of the 3 different types of things that you can do at the hospital. I'll send this to Becky so that she can put our webpage out, and also if you want to ask any questions you can do at volunteerservices@wsh.nhs.uk. Don't know if anyone's got any questions you want to put in the chat. Very happy to answer anything, you know, while we continue with the rest of the presentation.
Thank you, Rachel. I actually have a question, but yeah, feel free, if anyone wants to put in the chat, please feel free to put your questions in there. But what would be your kind of top piece of advice for students doing those clinical placements to get as much out of them as possible? Because that's an amazing opportunity, isn't it? It looks so good on their CVs as well.
Yeah, and it's asking lots of questions. I mean, sometimes students are quite nervous about asking too many questions, but it's you know, it's the best thing to do. And especially if you're shadowing a junior doctor or somebody like that, you know, you can find out about what their experience was like in medical school. You know, you can find out what their sort of year 1, year 2 has been like. It's yeah, really good experience. Just ask lots and lots of questions. One thing I would say about your application forms, be thorough with them, with your personal statements. Don't just write small statements. Write you know, a good meaty statement, because it is your first impression.
I think we have
had a experience. Sorry,
yeah.
I just seen that. Yeah, how do you experience the children or psychology? Unfortunately, you can't at the hospital. It's just one of the no-nos. I'm afraid. It's I'd like to change it, but I can't. It's yeah, unfortunately, those areas just we have a small psychology team, so that's some of the issue. But we do have on site, we have the Norfolk and Suffolk Foundation Trust, which is our Wedgwood house, which is the mental health team. So Norfolk and Suffolk Foundation Trust do have their own work experience. So you may be able to contact them and they may be able to help out. But children, definitely not. We can't do that, unfortunately.
Thank you, Rachel. And the other thing, Kath, that we can look at doing, there are resources out there that we can show you that are to do with sort of virtual work experience. So you can get virtual work experience around, especially in psychology. I know it's not exactly hands-on, but it's still something that you can say, yes, I've gone and I've done this, and you can put it on your CV or your application. So if you, I don't know if you're a student at the college, one of the colleges, then please do contact the careers team and we can help you do that. We also have another question. Interested in nursing, was wondering if there are any work experience or shadow opportunities in nursing department. But that's yep. Those clinical opportunities, isn't it, Rachel?
It is, yeah. So if you look on our website, they are set dates. We do 1 date a month. And if you look on our student programme page, you've got the application form. Send that through to me. Once we get all the application forms set, then what I do is pass you over to the education team, and then they'll look at the different departments that are available. So we could have the fracture clinic, will have outpatients. We might be able to have children's outpatients. Sometimes we can go in there. But yeah, you get the choice of where you want to go, as long as the department's available that day.
Fantastic. Thank you. And Ruby, did you want to?
Sorry, I'm just switching to my work placement hat now. And the answer to the psychology and children's answer is what we've always said is, if you're looking to work in the hospital in these departments, any experience with any people that you get within the hospital for clinical shadowing is important and all worthwhile. They're all transferable skills, and even though you're not particularly working potentially in a department that you necessarily want to go into in the future, you're still understanding what it's like to be on a ward. You're still understanding, you know, the experiences and the responsibilities that you'll have. So it might not be the same age or the same group of people that you're looking or wanting to deal with, but all the skills that you learn in terms of communication, you know, all the responsibilities, you're being on time, confidentiality, they're all transferable skills that you can use across the hospital, no matter what department you're in. So it's definitely worth still applying if you're wanting to get the experience there. But also then think about, maybe if you do that 2 hours a week and you want to do a little bit more, ask maybe potentially a nursery, if you get DBS checked, etc. You've then got that age group, but you're also getting the transferable skills of being in the hospital as well, because if you're dealing with children, you're also dealing with parents, so adults, and learning how to communicate and talk through that is the same nevertheless. But sorry, I just thought I'd drop a bit of work experience.
That's amazing. Yeah, no, that's really, really helpful. Thank you, Ruby. Julie, did you want to ask something?
I just wanted to say that I think that's excellent. I've used to work for the NHS. I now work in care in a different role, but I did work for the NHS 111 service for a long while, and I think any experience of dealing with any healthcare like that, hands-on, and just being in a hospital environment is so important. My daughter is very proud of her. She's going to be going to train to be a nurse in September. She's off to university, but she did her level 3 health and social care extended diploma through the college in Ipswich. You're one of your partner groups, and through oh god, I can't think what they're called now. Suffolk One. So she did Suffolk, her qualification at Suffolk One, and then in September she's going to be a nurse. She's decided to take a gap year, but at the end of the college period, towards the end, she did a 2-week placement at Ipswich Hospital. Fantastic. Those nurses were incredible. They really inspired her, to go for what she wants, and she's taken a year to save up so she can afford it, and that's what she's doing. So, and she probably wouldn't have been as inspired by that if she hadn't have gone to those wards and into sonography and had helped out with real life people. It was incredible. So it's really good.
Yeah, completely agree with that. So we're going to thank you for your questions and your observations there as well. That's really helpful. We're now going to move on to Holly, who is a current apprentice within health and social care, who's going to talk about her experience. You want to share your screen, Holly, or are you happy just to chat?
I'm happy just to talk. I'm a talker. You'll get to know this pretty quickly. My name's Holly. I am a nursing assistant or healthcare support worker on a medical ward at West Suffolk Hospital. I've been there for about 2.5 years now. I started when I was 18, and I started this job with absolutely no healthcare experience, which I would not recommend. All these things these lovely ladies have said about doing volunteering or getting any kind of experience, I would highly recommend, because it was a little bit like a baptism of fire when I started on the ward. I'd never stepped foot on a ward before, and all of a sudden I was working there. So I had no experience in healthcare, but I learned pretty quickly. I loved it. I'm very passionate about my job. I love looking after all different types of patients, particularly elderly people. That's where I really shine. And I had my appraisal last February, so a year ago now, with my ward manager, and I wanted to know if there were any opportunities for me to sort of expand my knowledge or just get to know more about the nitty-gritty about what goes on throughout the whole hospital, not just my role. I'm one of those people that always ask why. I'm never happy just being told what to do. I want to know, why do we do it though? Why are we, why have we got this policy, and why do these people do that? And I love being patient facing, but it does mean that you miss out on a lot of the other job roles and sort of the other nuances of other people's job roles. So my ward manager was very kind to sort of show me the level 3 senior healthcare support worker apprenticeship. So I applied for that and I got in. Very grateful, very happy. Thank you very much, everyone. And I've loved it. What's been great is that it's given me answers to those why questions, and it's given me the time to really delve into policy and procedure and get a deeper understanding about all the other sort of roles that there are in the hospital. So my sort of week now is I have protected time. So every week I get 6 hours of protected time to complete college work or do studying. So I have like a week A, week B. So week A, I'll go into the education centre at West Suffolk Hospital, and I'll be with the other people who are doing my course. There's about seven of us, and we get a sort of directed learning. So I had one today, so we did sort of pain management, and we had someone from the one of the pain lead nurses came, and she gave us a talk about pain and what we need to do to reduce pain, what our role is in it, how other people's roles affect how we treat pain. And then sort of my week B, I have 6 hours of protected time to either complete assignment work. So a lot of the work that I'll be assessed on will be my written work, and then observations as well. but I'll get time to complete my assignment work. So I'll have now an essay due about pain management and what that means for my role. But also that time can be used to sort of shadow other colleagues or go to other areas of the hospital and really understand what they're doing. So it's I took the opportunity to shadow some of the doctors. A lot of the time in nursing, it's always sort of a us versus them mentality. It shouldn't be, but it is. Of, you know, when you don't understand why other people have their priorities, especially with the doctors who, you know, if you don't understand why the doctors are doing anything, you think, well, they're just not listening to us. But actually, they have different priorities, and it's really good to sort of get into their world and see what they've got to deal with. So I spent a morning going on their ward round and then attending the ward round meeting, which is something I'd seen them do, but being a part of it was, you know, it's very enlightening for me because it gives me a lot more nuance about how my role affects what they can do. And that's what I love to sort of learn about. It's like I also got the opportunity to go down to pharmacy and see how pharmacy works. There's a lot of talk about we're always waiting for meds from pharmacy. Where are the meds from pharmacy? But when you go down there, you see what pressure they're under, what kind of jobs they have to do, what sort of responsibilities they have, and just get that insight, which is really great. Again, I had no experience in healthcare beforehand, so I'm sort of like, you know, starting from quite basic. And I had experience now on the wards, but getting that sort of just that time to really delve into the policy and talk to other people about their experiences and sort of understand, you know, where that can take me. I'm very now set that I want to do nursing, but I wouldn't have been before. What's great about this apprenticeship that I'm on is that it's really shown me sort of which areas I can go into. You know, things that you wouldn't even think about, like sterile services we went down to. If I wasn't so, you know, if I didn't love my patients so much, I probably would have loved being down in sterile services. I like things being clean. I like to see how they do their things. And it's something that you don't often get to see, especially if you're just with the patients all the time. So I'm very grateful for the opportunity to do this apprenticeship. I've really, really enjoyed it. I'm about halfway through, I think, well, maybe a bit more. I think my one takes about 2 years. I'm about nearly a year through. So yeah, I've really much been enjoying it, and it's also given me a lot of confidence within my role. I've been able to take these skills back to my ward setting and just be able to feel more confident about sort of speaking up about patient care, you know, putting things in place, seeing things from a different angle, which all leads back to just making it better for the patient. You know, our patients and our service users should be at the heart of everything we do, and having that sort of ability to, what's the word? Oh no, I've gone blank. Sort of, you know, build on my knowledge and build on my skills is really will always go back to the patients and will always really help the patients. And it also means that I get to help other people in the ward sort of see things from a different angle and help them with different challenges. And sort of I help a lot out with people getting their care certificates signed off because I sort of have a lot of more of that knowledge about leadership through this apprenticeship and what kind of things, you know, you should be practicing and what kind of things you shouldn't be doing and the nuances between that. So yeah, I'm very set now on nursing, and I feel a lot more confident about going into nursing. Before I did this, I was doing A levels. I didn't do very well at my A levels, and I was quite down on myself that I couldn't sort of do anything more educational like that. I didn't think that it was in the cards for me, but actually, what I needed was to be doing something on the job. I needed to be working and learning at the same time and seeing what I was learning about in sort of reality in real time. It being theoretical didn't really sit right with me. So I've really enjoyed sort of, I learned something new in my study sessions. I'm able to bring that back on the ward and actually see it take effect and see myself getting better. So yeah, I'm very confident that I'm going to go into nursing afterwards. I'm really hoping that I'll be able to find a route into nursing, and I'm sort of more willing to sort of push myself to do that, which I probably wouldn't have before. So yeah, thank you very much. I'll talk passionately about healthcare all day, so I've got to stop myself.
the nursing profession are going to be so lucky to have you. It's so clear that you're just passionate and you love your job, which is great. So lovely to see. So thank you so much for that, Holly, and giving us that little insight into it, and the kind of skills that you develop and the knowledge that you get of other teams, and doing the care certificate mentoring alongside as well, which is fantastic. So thank you for that. I'm going to hand over to Julie now to talk about her experiences. Thanks, Julie.
Hi there. That was lovely to hear, Holly. You're an inspiration, quite frankly. Yeah, my daughter's very much like you. She can't wait to get going and to help people, which is incredible. I've had lots of roles over my years because I'm 52 years old. But I started my life career, should I say career, in an office. Quite bored, really. And I spent 15 years sat at a desk doing bookwork, that kind of thing. I didn't hate it or anything, but it never really inspired me to do something more. I wasn't particularly academic at school. I left with very basic GCSEs and just fell into office work. It was easy. Then I had my children. And after I had my daughter, I got a job working for Meals on Wheels on a weekend. And it just got me chatting to elderly people. And that is my first time that I fell in love with social care, because they have so many stories to tell us, so much experience of life. They've lived a completely different life to us. And most of them are just so grateful for the support that they have. So I work in recruitment now and training. I'm a qualified trainer, so I train our staff on the care certificate, all the mandatory training that we should do as per our CQC. So they regulate everything that we do. And to do my role in the office, well, I'm sort of jumping around a bit here now. So I started in an office, then I went into Meals on Wheels, then I went into the 111 service as a call handler, then I trained as a coach, and that's when the training start of my journey began. And then my mother developed dementia, and I watched her suffer with that for 8 long years. And it wasn't really until then that I'd really thought about working in health and social care, apart from with Meals on Wheels as well. But my mum had incredible home help. They were amazing. They are the company that I work for now in Staymarket. They saved my sanity, really, and the rest of our family. And I saw what dignity and respect they gave her. And I honestly cannot put into words how passionate I am about dementia care. It's huge. So my advice to any young person in this day and age would be to consider working in health and social care. It doesn't have to be as a carer. I've become a recruitment lead and a trainer. I do some care as well. I love it when I can get out of the office and go and see our clients. My daughter is now doing some care hours for us until she starts her nursing qualification, because of course that's going to get her used to dealing with people's health and looking after them, helping them with food prep, medication administration, personal care, all those things. She was very nervous when she started, but she's really blooming, and it will help her with her other skills as she looks to go into nursing on wards. But yeah, I think if you're looking at a job or an apprenticeship, I should say, thinking about working in any type of health and social care, you're going to get reliable employment from it. You're going to get a good pension when you're my age. That's important. You've got progression all of the time. You've got people around you to support you and encourage you. It's incredible. And I really wish that I had looked at doing this kind of thing, level 2 or level 3 qualification in health and social care back then. It would have saved me a lot of time. And I'm very proud of the work that we do. I see our carers come in, the ones that have not worked in health and social care before, and the pride that they get from their work, the change in them as they grow confident with their work. And I've just recently finished my level 3, because to work in our office, you have to have a qualification, at least a level 2 or above in health and social care. So my manager said I had to do it, and I was like, I'm not the most academic, but actually my tutor called Lee at West Suffolk College was phenomenal, so supportive and encouraging. best thing I've ever done with my time. It really is. Because now I've got that. I already had quite a lot of knowledge because I'd been worked at 111. I've worked in healthcare, and I've done social care work. But actually having that talking about all of my experience, and it just helped to underpin it in an ongoing and helpful way. And she was really supportive, incredible. And now I'm encouraging our staff members to get trained up as well. And I've enrolled a few of them with Ruby this week. So yeah, I recommend looking into healthcare. You're never going to be bored. I'm not saying office work isn't for some people, of course it is, but you are going to have different exciting challenges every day. You don't have to be a carer. If you're going to go to health and social care, there's social workers. There's so many roles that you can do. And I also had a brother with learning disabilities. So people like Dimensions, phenomenal company. They really are. So there's loads. The sky is the world is your oyster, I should say. And I would definitely have a look at doing an apprenticeship with health and social care. It's a really good thing to do.
Amazing, thank you. And a question for Holly or Julie, really. Just interested to know, what's your most kind of rewarding experience so far as part of your apprenticeships that perhaps you weren't really expecting, but has really just kind of stuck with you in a sort of rewarding way?
I think the confidence it's given me, because I think I had all these skills, but I'm just not a confident person. I train staff now. My boss was laughing about it with me this morning, our manager, because she was going on about what a natural I am with people. I'm not a very good public speaker. I don't think of myself like in that way, but my knowledge is all there, and because I've got that background of knowing what it's like to be a client's daughter, and to be the carer and to be the person who's recruiting people. It really helps me just understand what people need. And my favourite part of my role is seeing our staff learn and change, and how when they realise that they've done something to make a difference to somebody's life. Huge. And that would be exactly the same, really, that rewarding feeling. As Holly said, anybody working in health and social care gets that, I would say, almost on a daily basis. There's got to be, you're going to have bad things. There are harder days, like there is for any role and any environment, but the good is always going to outweigh the bad, because you're doing something worthwhile with your time. And you're always going to have a job, quite frankly, which is huge.
Yeah, they're very meaningful as well. No, that's really lovely to hear. Did you want to add on to that, Holly?
Yeah, I think one of the more, like you said, you have great days and you also have very difficult days. But one of the surprising things is my difficult days have become a lot easier since I've been doing this apprenticeship, because I just am able to, I've learned how to reflect a lot better. I've learned, I have more confidence to know that even if something didn't go quite right, I work with a lot of people with dementia. Even when things don't go quite right, I have the confidence that I did everything right, everything I could have done. And it just gives you a good template that everyone's an individual, but having a good template about how to sort of tackle individual needs is so important. And the confidence I've gained, I just have a lot more fun with my patients. I think people when they're in hospital, you never think about having fun. You never think about lightening the mood and things. It's always a very dour sort of mood. But now I feel more confident in myself and my role and what I can bring to other people. I'm able to have those fun moments and make it more interesting, and sort of, deal with people's holistic needs that, really do get skipped over a lot in healthcare, particularly when you're speaking with doctors and physios. Everyone's got this mind of what medication should they be on, what should we do? But actually, sometimes all people need is a cup of tea and some music on, and that sort of having the confidence and really getting into the understanding of that through this apprenticeship has made me more likely to speak up and go, no, let's get to know this person. What do they actually need? Particularly with our confused patients and our delirious patients and our patients with dementia. So yeah, I just feel like I've grown in confidence and I'm able to sort of speak up more about these issues that I feel so passionately about.
Oh, that's lovely. Thank you. Yeah, so confidence, empathy. I love that you said you have fun with your patients because, yeah, probably some of their really dark times in their lives, it's nice that they've got a smiling face and they can have something like a good experience out of what they're going through. So it's really nice to hear. Thank you so much, both of you, for sharing your experiences with us. We're now going to go to Tamsin, who's going to talk a little bit about your role in social care, or your previous role in social care. Oh, you're on mute.
Sure, I just pressed that, but someone had to do it, so never mind. Yeah, I absolutely am. And firstly, just want to thank both Holly and Julie for coming on today, and just highlight actually that the tutors that are supporting both Holly and Julie have worked in social care. So when we're looking at careers and in directions that careers go off into, you know, the people that have supported Holly and Julie are now classed as assessors, but have that background knowledge in health and social care to be able to assess. So there are so many routes in health and social care that you can end up in, some of them that you just really don't think about. So I've been in health and social care for the majority of my life. Similar story to what you're hearing. I didn't particularly get on well at school and didn't think that I could learn, but actually learning in a different environment and in a different way, I can do apparently really well. So who knew? So I done my level 2 and my level 3 in the learning disability world is where I've come from, in many different roles, working out in the community with people, keeping them out of crisis so that they can stay living in the community. I've also worked in supported living services where we've got people living in shared accommodation but really living meaningful lives out independently rather than living in those residential homes. I've, like I said, I've done my level 2, my level 3, and then I went on to do my level 5 and did become a registered manager in health and social care. I've run multiple services, some domiciliary services like Julie's just talked about. Domiciliary care is the care that we call out in the community. Also run some supported living properties for adults with learning disabilities, and dipped in and out of adult care. The majority of my experience is around learning disabilities for similar reasons, Julie. I actually think adults with learning disabilities have a lot to offer people. They genuinely just live a really happy and quite simple life. And some of the things that really weigh us down, just don't worry them. It just doesn't even enter their radar. So it can be really rewarding being around these people. It's twofold, you know, they're rewarded from us supporting them, but I definitely feel fulfillment from going out and supporting people. And you build relationships. Some of the people that I've worked with for 20 odd years, keeping them out of crisis, keeping them living independently. You really do build some really strong relationships. I did dip out of health and social care. Interestingly, and this is what I wanted to talk to you about today, I ended up moving over into case management. So I don't know if anyone knows anything about case management. Case management tends to be in the brain injury world. So if you've got someone who's ended up with an acquired brain injury, often they need a case manager. So case management is exactly that. So it's a coordinated approach to support an individual. So if you imagine that somebody's come off their motorbike, they're in hospital, having their brain injury sorted out as much as you can. We know if there's injury with the brains, often it can be rehabilitation can be really difficult, and sometimes it can be unpredictable. And that's where case management comes in. So a case manager would support that person. They'd normally be allocated at the time that they're coming out of hospital and going into rehabilitation. And that case manager will work with them probably for the whole of their lives, depending on the case, because it can really vary depending on the accident. They work with children and adults. They generally have a social worker's background, but you can be an assistant case manager without having a social worker's background. And it's a really interesting side of care and support. So anybody who's been in care and support know that financially there can be a lot of constraints around what you can and can't do. And sometimes that means that people, as much as we tried, everybody in the industry tries to treat everyone the best, to give them the best life that they can. And as individuals, you genuinely can do that in case management. If they need a house building for them, a house will be built for them. If they need adaptations, you would get someone in to do the adaptations. If they need to have physio on a weekly basis, they have physio on a weekly basis, and you as the case manager coordinate all of that for them. So whatever they need, it might be speech and language, it might be that you've got to find the right school if it's someone still of school age for them to attend. It's so varied and so vast, and you can, it's one of the areas that you can really make a difference in. So I said social workers, actually OTs can become case managers as well. It's an industry that you can do self-employed, or there are companies that do run it. You do have to have the, similar to nursing, so you do have to be registered with Babicum, which is the industry that runs brain injury and sort of sets the standards for what's expected in case management. But just wanted to sort of let you know that there are different types of job out there. It's a good earning job as well. So you might be thinking, where's all this money coming from? So I should probably explain that part of it as well. So money is there because generally someone with a brain injury, if it's not been their fault and it's been someone else's fault, then it may have gone to court, and there might have been some settlement money there. How does that happen in children, you may ask? I'm really sorry, Rachel. I know you work for the NHS here, but sometimes the NHS makes mistakes, and sometimes people do end up with a brain injury through being born or something that's happened just after birth. So for whatever reason that person's, if it's not their own fault and there is blame there and there's a claim, then generally a case manager will come in, because on the other side of supporting the client, they also have to work really closely with solicitors through most of the journey that the person goes through, because often what happens with someone with acquired brain injury, if they don't have capacity to look after the money that they get through their settlement, then the solicitor will continue to look after that money for them, but the case manager manages it. I hope that all makes sense. It's a really complex area to go into, but it is so interesting. So when I worked in case management, you have a certain amount of cases that you look after, and they are genuinely so varied. I had some really profound disabilities where the brain injury was quite severe. So they would have their own team employed to go in and support them with their own team manager, and the case manager's job was to make sure that all the employment stuff was there. They work with the solicitors and to make sure that that little case runs perfectly in that house. And then they might have someone else that actually doesn't need any care and support, but still needs the case manager in there just to help them to make sure they've got everything they need. Maybe they need a bit of physio, or they might only need someone to go in and help with shopping once a week. So it's really varied. And then, like I say, you might have children that you're going in and you're adapting the family home to be able to support that child so that they can stay where they've been living, or you might be looking for some respite support for that child so that the family can have a break. Or it might be holidays as well, which can be really complex to book, but there's been some amazing holidays that people have ended up going on. But the liaison between, let's say, getting all the equipment on the boat that you need to sorting out the passports, that's exactly what your case manager would do. So it's so varied, as is every role in health and social care. And it's varied because we're working with people, and you just never know what you're going to expect, what you're going to walk into. Like I say, I've worked with people for nearly 20 years, still walked in and not knowing what I'm going to expect on that shift. You can just never tell. Yeah, they say don't work with people and animals, don't they? But I would say the opposite. Working with people is amazing. You don't have the opportunity to get bored of the job and career that you're in. One last thing I'll say about health and social care for everybody that is listening is it is a really supportive sector. So if you are worried, or you're feeling nervous or concerned, or, you know, maybe you don't feel like you have a lot of resilience, health and social care will help you build that resilience. It is absolutely amazing to its employees. It really understands the job that you're doing, and the value that you bring to the sector. And I think that's all I've got to say today. Thank you for listening.
That's great. Thank you so much, Tamsin. And our students will have noticed that last week we were putting a big emphasis on lots of different roles within health and social care. And just to touch on social care a little bit, Tamsin, you've mentioned a few things, but what's sort of the one thing that stands out that you wish people knew about social care going into it?
I think that and it's awful, and I hate going back to it, but it's really not all about wiping bums. It really isn't. In fact, in my life, in my whole career, which is about 25 years in social care, very rarely have I gone near a bottom, or had very much to do with personal care in any way, shape or form. In the learning disability world, it's generally, unless they're quite profound and they need you to do everything, it's always about encouraging, and with the elderly, it's always about encouraging independence. So it is always, you do as much as you can, you mirror, you work alongside. It's not about doing for people. It really isn't.
Oh, I love the way you answer that. Yeah, completely agree. Are there any questions? Please do continue to put them in the chat, and I'll just second what everyone said. And thank you so much to all our speakers, because you've all been absolutely amazing. But I come from a background in health and social care myself as a nursing assistant, and I think it just kind of goes to show that you can take the skills that you're learning within that kind of environment and take them into something completely different. And in a world where people don't stick into one career, you're constantly building on those skills and those experiences. So yeah, health and social care is brilliant, and thank you so much for sharing all your experiences. It's been really fantastic to get all your sort of helpful insights, and hopefully it's helped everyone understand a little bit more about what apprenticeships are involved as well, the opportunities that are available, and how you get access to those as well, which is really important, and how you find out more about where you could go and what you could do with a qualification in health and social care. So please remember, that there's a lot that we've covered, but you don't have to figure everything out on your own. So we have a large range of support for students that's available to help you explore your options and plan your next steps. So please do come speak to the careers team. We can help you understand sort of different pathways, obviously exploring careers in health and social care. Speak to the apprenticeships team as well and your course tutors, and explain more about the kind of training programs that are on offer and what employers are looking for. And how to apply for those opportunities when they become available. And Rachel is a really good person to speak to about getting that experience as well, which is so important. So remember, if you're a current student with us, you can definitely book a one-to-one careers appointment if you want to have a chat. And if you're not a current student and you're joining in the future, for example, obviously you will have access to that same support when you do arrive with us. So just before we finish, does anyone have any final questions? Feel free. Oh, Julie?
I was just going to say, it's progression as well. So some industries, if you go into, then that's pretty much all you can do. You're quite restricted what you can do, but not in health and social care. As Tamsin just said, there is so much that you can do. I have washed a few bottoms in my time, but as you said, it's all about independence, encouraging people to be independent. Most people want to do it for themselves, but it's not about that. It's about helping people. If you have the empathy within you to be able to care for people, then you can work in health and social care. And the sky's your limit, because there are so many roles you can do. I wished I had done that 30 years ago. So there you go.
Thanks, Julie. And we've just had another question. So does the hospital have social workers working there? And if you did work experience there, would there be any chance to spend some time with the social workers at the hospital? Are you all right to answer that, Rachel?
Yeah, I don't know. I don't think we have social workers as such. I think that would be more Suffolk County Council that does that, but I can go away and find out.
Thank you.
Oh, I just wanted to say, sorry.
Go for it.
Sorry, social workers sometimes do come onto wards. So if you're going to do volunteering on wards or shadowing anyone on wards, you will see social workers, but I don't think they work, like Rachel said. I think you have to go, if you want to do social work, that kind of side, you have to go through Suffolk County Council, I think. But you will see them about, and I'm always chatting to them. I chat to everyone, but you can get some bits of information from them if you shadowed on a ward.
So again, it's about being in that environment and being having access to those different roles, isn't it? And Julie, did you want to jump in?
Yeah, I speak to social workers from the hospital all the time. almost on a daily basis about someone being in hospital. I did on Friday actually. So they are there. I don't know whether they are social services, social workers, but they are also there a lot, and they do call me from there a lot because our clients often have a fall, say, then they go on to a ward, and then we speak to the physio team, and it all comes within that social worker's caseload as to when they're going to be well enough to come home again and what equipment they can give them to make things easier, that kind of thing. But yeah, they are there.
Thank
Great,
you.
thank
I'll
you.
see what I can find out and come back to you.
Lovely, thank you. Thanks, Rachel. That'd be fantastic. Unfortunately, we've run out of time, but it's been just so amazing to hear from everyone, and I hope everyone's taken something away from it. But yeah, thank you so much for spending your evening with us, and we hope to see some of you in the future. And any questions, continue to put them in the chats, and hopefully we will be able to answer them. I'll be able to send out a follow-up email, and I will send this recording on as well, so you've all got it all. Yeah, just seeing that. Yeah, the recording will be shared probably tomorrow now, but it will be out there, and it will also be available on the website as well, on our new look website that is coming soon, as all the Empowered recordings are. So thank you so much, everyone.
Thank you very much.
Thank you.